Co-occurring disorders is a very broad term that can mean multiple things. In the medical world, it could mean having asthma and diabetes. For us at Westbridge, co-occurring disorders means that somebody has two distinct brain diseases that are occurring at the same time. They're both primary illnesses, so we see both depression and cocaine dependence as being primary co-occurring disorders, just like if you had heart disease and hypertension. For us, it's about treating both in an integrated fashion at the same time and understanding how one affects the other. But it's all about the relationship. So if I can connect really well with you, you're going to have a good outcome. As with any chronic brain disease or medical disease, we know that lifestyle plays an important part in recovery. And when we talk about lifestyle, we're talking about sleep, we're talking about nutrition, we're talking about exercise. Individuals that come to Westbridge typically have had 2 or more other treatment episodes. Because we're all individuals, these brain diseases take shape in everybody a little bit differently. Schizophrenia and other major mental illnesses in men seem to start in late adolescence. In women, it's usually early 20s. Substance use disorders can start as early as, elementary school. Early on, they may have some struggles with learning, or they may be there may be a trauma early on. Our guys tend to start out experimenting with substances, and then they'll may develop symptoms of depression or anxiety, or maybe they were diagnosed with ADHD. With all of these brain diseases, one of the components is genetics. So that testing provides is like the first opportunity to really be able to individualize care. So you know which medications are effective for one individual versus another. Medication monitoring during treatment for folks that have co-occurring disorders is really essential. Medication provides the platform for a lot of folks to be able to organize their thoughts. If you're using an opiate replacement medication like Suboxone, you really have to be able to monitor for safety. At Westbridge, when we do drug testing and somebody comes back positive for something that we didn't prescribe for them, it becomes an opportunity to do an intervention. Currently, with all the designer drugs that are available either at the local convenience store or on the street, we don't know what people are taking. They don't know what they're taking. Some of these designer medications causes tremendous damage. We had one young man who got spice at one of the corner drugstores, and he has schizophrenia. He was doing fine, took the spice, he ended back in residential program. He couldn't find his way to his bedroom. He couldn't remember which fork, what to do with a knife and a fork. We thought he was going to end up with assisted living. It took him about 5 months to clear, but because we were able to get him tested and the urine panel showed that he had been using spice, then we could say, okay, this is what's happening. This is chemically induced. Safety. It's about being safe. It's about being honest. It's about saying, okay, let's stop this before it gets worse. Advice to therapists treating co-occurring disorders is to really understand that they're both primary illnesses. One's not secondary to another. That's crucial in people being able to get effective treatment and into recovery.